Hello, my name is Dr. Oleg Drut. I'm orthodontist and clinical director of Diamond Braces. And in this video, we're going to talk about possible emergencies while having Invisalign treatment. Again, the good thing about emergencies, the majority of them can be taken care of at home. Again, you are welcome to come at any time to our offices when we work, but I'm going to explain the solutions to certain common problems that can arise during the treatment. First of all, sequence of wear. Remember, each aligner have the number, okay? Something like this. Make sure you don't skip the number. If you skip the number, they're not going to fit. Remember this. So I know some patients, they complain, oh, my aligner is not fitting, but then when you look at it, they skip 3 numbers. You cannot do that. Remember, 1, 2, 3, 4, and so on, right? Each number, usually you wear for about a week, okay? Again, variations happen, listen to your doctor, but do not skip the number, okay? Remember this. Now, sensitivity. Sensitivity is normal. Think about this. Mouth is very sensitive part of the body. You buy new shoes, you feel sensitivity, right? You have to get used to them. Same in the mouth. It's much worse, actually. So the teeth can be achy, especially at the beginning. Be patient, okay? Sensitivity is absolutely normal, especially when you wear the new aligner, new tray, right? So usually sensitivity goes away quickly. Remember, if you feel sensitivity, just take some Advil, okay? If it happens, right? Or just tolerate it for a day or two. It usually goes away. That's a good thing about sensitivity, but it's expected and it's normal. Now, gaps between the teeth. The way the aligner work and programmed, okay? They create small spaces between the teeth. That's absolutely normal. Don't be alarmed if you see the teeth are moving and you have separation between the teeth. That's expected, that's programmed, that's normal. Stay assured those gaps will be closed when we finish the treatment or during the course of treatment. But please do not be alarmed or do not panic. That's absolutely normal, okay? Bleeding from the gums. Again, why the gums bleed? Remember this. The gums bleed because of signs of inflammation, okay? And that's bacteria causing the bleeding. So when you see bleeding when you brush, make sure you brush more those areas. Don't be afraid. I know some patients come to me, oh, you know what, I'm not brushing because my gums bleed. Wrong. When you see bleeding, you concentrate more and more on that area and use the toothbrush with the hard bristles and massage the gums. Use a floss, use water floss, okay, mouthwash, and the healthy gums do not bleed. Remember, if you see bleeding, concentrate more on brushing, okay? This is not caused by aligners, it's caused by inflammation on the gums, hygiene basically. So brush more. Any questions? Of course, you can address us and ask us questions, but usually most common issue with bleeding, that's a lack of, it's inflammation of the gums, okay? Loose teeth. While we move the teeth, they become slightly loose. Don't be alarmed, that's normal, okay? That teeth are moving, it means teeth are moving. So slight mobility, it's expected, okay? Usually when we finish the treatment, you will get your retainers, you enjoy your beautiful smile, this mobility will stop, okay? But again, mobility or loose teeth, slightly loose. I mean, I'm not talking about those, you know, you're not going to lose your teeth, okay? But slight mobility, it's called mobility, it's normal. So don't be alarmed. Any questions, you can always email us at info@diamondbraces.com and we can answer all those questions, right? Now, gum irritation. Sometimes the aligners press on the gums, okay? Remember, the aligner is an artificial device. If they press on the gums and you feel irritation and pain, you gotta trim that aligner, okay? You gotta trim it. How you trim it? Take a nail trimmer, the board and trim it, or use scissors, manicure scissors, and just cut it, those ends, okay? Don't be afraid to cut small ends of those aligners where they press on the gums. The aligners will still work. It's not going to stop working, okay? But you're not supposed to feel pressure on your gums when you wear the aligners. Remember this. If you feel pressure, it's not good, especially if you feel pain when the borders of the aligners press on your gums. Remember, trim those aligners without any side effects. They're still going to work, but you're not supposed to feel any pressure when, on your gums. And the way you trim it, so basically what you do, look, you take the nail board or small scissors and just cut it. Cut it here, whatever is, any spot where it presses the gums. Don't be afraid to cut them. That's absolutely normal, okay, to cut them. It doesn't happen very often, the gum irritation, but if it happens, again, just cut it. Not a big deal, okay? Attachments or buttons. So not every case, but majority of cases we put attachments on your teeth. The purpose of those attachments, they're white bumps, right? Made of composite. It's like sort of like a handle. Think about this. So you have a tightly closed door and you have a handle. So you grab the handle, you open the door. It's very similar with those attachments. They're specially designed. We put always extra attachments, and the way we program those aligners, they can even work without attachments. Remember, if attachment is lost, okay, while you eat something, don't be alarmed, the aligners are working. As long as the aligners are fitting, that's the key. Aligners are programmed device. Each aligner will move the teeth 0.2, 0.3 millimeters, okay? So as long as they fit, even without attachments, they're still working. This is not an emergency. And some attachments will be broken during the course of treatment, okay? Because you have, usually we put about 20 attachments in the mouth, okay? 18 to 20, sometimes more. So that's important to understand. If attachment is broken, you know, this is not an emergency, don't be alarmed. You can always come at your regular visit, if we think that we need more attachments, we can always put them, okay? But your job is to wear the aligners and follow the instructions. Eating instructions, brushing instructions, that's your job. Compliance, right? Attachment breakage, expected. Some of them, not all of them, some of them. Majority of patients will have some breakage, okay, of those attachments, but that's expected, normal, and doesn't cause an emergency, okay? Now, a lost aligner. That's another very common emergency. If you, for any reasons, remember, never put aligners when you eat in a napkin because you're going to lose it. How people lose aligners, a dog eats them, okay? Again, if you have a pet, be careful, or they lose it while eating, okay? So that's why you have this box, okay? This box, always keep it in the box. Always keep it in the box. Don't put it in the napkin. You're going to lose it, okay? Now, if you lose the aligner, go to the next one right away, okay? So let's say you wear aligner number 5, you lost it, go to aligner number 6 right away. Usually, most of the time, it's going to fit. And then you wear some extra time the aligner number 6, okay? Now, let's say you don't have aligner number 6. Then you go back to aligner number 4, and then you see us. So we can order new aligners for you, okay? That's why it's important to keep the last aligner at home, just in case if you lose the one that you currently wear, and you don't have the next one, or if the next one doesn't fit, okay? But majority, 90% of cases, next one will fit if you have one, okay? So remember this. You lost the aligner, go to the next one. And keep them extra time in your mouth, right? This is important. If no extra one, if for any reason you don't have the next one, go to the previous one. That's why do not throw away the last aligner you wear, okay? Just keep them as insurance, okay? That's all. So that's another thing, okay, what you have to remember. Another common emergency, loose ends of the aligner. Some patients have crowns in the back, some patients have small teeth in the back, and then aligners, we don't usually put attachments in the very back teeth. So sometimes the aligners is like this, you know, and they don't really cover the last teeth, okay, and it's very uncomfortable for the patients to wear, right, like this. So what you have to do is very simple. You remove the aligner, okay, and you just, the part where it's not fitting, okay, you bend it like this. It's almost 90-degree angle. You see what I'm doing? Look, like this, right? Again, you're not going to break this thing, okay? This is smart track material, very flexible. That's why we recommend Invisalign, not other companies, because smart track material is one of the best material, not one of the, it's the best material out there, right? So you bend it like this, and then you put them back, and it's going to fit right there, okay? So again, if for any reasons you feel discomfort in the very back, and aligners are not sitting all the way, you have to bend it with your hand and just put them back, and it's going to fit perfectly, just like that, okay? Okay, that like this, and it fits right there. Okay, perfect fitting, okay? Those are the most common issues that I just described. Again, aligners are a great product, and you made the right decision choosing Invisalign. If you have any questions, you can use our emergency portal where a dental professional will explain and inform you how to deal with any issues. And you can do a video call there, you can text, you can email, or you can see us obviously in the office if you choose so. So emergency portal address is www.diamondbraces.com/emergency. I'll repeat, www.diamondbraces.com/emergency, okay? Or you can give us a call at 201-308-8181. Again, 201-308-8181. Thank you very much for watching and have a great day.